Think it's time we rise up, people. It's time's up, people. You can talk all you want, but it won't change a thing. I wanna know what you do. Hello, everyone, and welcome to the Up and Up. Right now, we're preparing for the March for Medicare for All. It's going to be July 24th in Washington, D.C., a large one, and then there are going to be smaller ones in other states. And one of the speakers, who is also a Real Progressives volunteer, who's going to be speaking, is Cheryl Van Epps. Welcome to the show. I think that this is a really good way to kind of start talking about this. Of course, we talk about Medicare for All on a regular basis. It's a big thing for us at RP, and personally, I think a lot of us really care about it a lot. But I think what's really important is to talk about the stories behind why it's so important, right? Experiences that people have had that really clarify and illustrate why Medicare for All is so necessary. And Cheryl has one of those stories. She's going to be speaking at the Washington, D.C. event and housing up with the, shacking up with the Real Progressives press crew. So really excited to meet you in person. But I wanted to kind of give you this opportunity to share a little bit about your story. So tell me, what makes you such a passionate advocate for Medicare for All?
After going through the experience I went through, I felt like I needed to, well, number one, I had to recover. I was mom at the time, still am. And kiddo was number one. In fact, I say without my son, I wouldn't be here.
Mm.
So I had to recover myself to be able to take care of my son, my home, and get myself well so I could go back to work. That's another story. But I had to do that first. And that's really important because without healing yourself, you can't heal others. And you're not even aware of your environment until you're in a good place, until you've gotten rid of that pain or you've figured out how to deal with it. So once I was at that place, then I could start thinking of others and what they're going through, similar to what, not same, but similar to what I went through. And I wanted to be there for them because nobody was there for me. Throughout this whole process, I wanted somebody there to hold my hand, to help me through the paperwork, which I couldn't read. And I didn't have that because I was far from my family and my family background. I couldn't rely on them. It was just me. And that was so scary and isolating and depressing, and it hurt. So, again, once I was there, I wanted to do that for others. So I joined peer support groups. And oh my God, they were life-saving.
Hmm.
I heard others with similar story. It's like being surrounded by people with birds of a feather. You're like, these are my people. Nobody else understands me. You get little microaggressions from the outside world, so many different ways, because people expect you to be okay. You look okay.
Mm-hmm.
But that brain injury has affected many, many, many different, everything about your life is affected. So talking to brain injury patients, we've been almost in every department in that hospital, and we can tell you where the failures are, what's good and who to go to or not, talk to us.
I mean, it seems like even the idea that, you would be expected to read through all this paperwork and all this kind of stuff, understanding that with a brain injury, that of course is going to be much more difficult. It just seems amazing to me that you know, part of the process wouldn't be to provide you with the support that you need in that kind of situation, right? To be able to go through it with you slowly. But let's back up a little bit and talk about. I mean, what did happen? How did I mean? I know that that there was a significant brain injury, and I guess let's fill in a little bit of the backstory.
Sure. Let's go back to my childhood. I grew up, we were pretty active outside. My sister picked up a tennis racket, the heavy wooden kind, and she threw it like a discus, called out my name, and plop. Okay, that was my first one. Then my second, I was racing to get back to college in my car on a country road. I flipped it. So that was my second, and both were not diagnosed.
Hmm.
Nobody, they don't screen you. I laid on that stretch board and all, but nobody went through that or talked to me about what the implications were. Um, so that was my second. Then my third was I was playing floor hockey co-ed, and my teammate ran into me head-to-head collision. He got up, shook it off. I was floored, bloodied, broke my glasses, and it was like one uh, falling through gaps. I don't know what to call it. One thing after another. So I walked out that facility. Nobody stopped me to get me to fill out an accident report. They didn't call the emergency vehicle to pick me up and examine me. I drove home. Now, if I was in my correct brain, I would have said, hell no, somebody's taking you home. I drove home holding my glasses together. That's how bad it was. So, and I slept the night. And, if I had a bleeder, I would have been a goner in the morning.
Oh my God.
So when I woke up, I was feeling terrible. I knew my nose was broken. It was just throbbing. Um, I told my son, walk with mom to the bus stop so we can go get me checked out. So he's 12 years old at the time. So he walked with mom. It was a 40-minute walk. Got on the bus and saw urgent care. They did a CAT scan on me and told me you could have lost your eye. And I didn't even know that part. So that just like, whoa, it's like a blow to your gut. You don't expect that.
Right.
And not only that, but they said I had to have surgery immediately. So got my ex to hook up with my son. He was taken care of. I went in for the first surgery, and already the waiting room made me just have a headache. My TBI symptoms were just throbbing. But going under the knife and coming to was the worst thing in my fucking life I've ever experienced. It was 11 on the scale of 1 to 10. I went through birth, labor pains, but this was absolutely inhumane. So I came to and I started vomiting, and I just kept vomiting all the day long. They sent me home like that. They sent me home, and I look up later the criteria for release. If the patient was in too much pain or vomiting, so those two things, they're not supposed to release you, and they did. The room was spinning because the surgery they did, I have a little graphic, but they put a metal mesh plate under the eye and they replaced the bone that was broken. So in that area is a cranial nerve, and they must have damaged it, but that may have been causing all the pain. That explains it. So my eye, because of the tissues are all inflamed, the eye sits above where it should be. So I have double vision. And that's supposed to resolve over time. The inflammation goes down, and then your eyes should be level and you should have normal vision.
Mhm.
But after a week, my checkup, they did an x-ray and they found that vomiting I was doing must have displaced it. So it was out of position. So in order to put it in, see, I should back up and say that again. In order to put that mesh plate in, they drill into your skull and they put screws. So I've had ankle surgery where they put in 6 screws in a plate. They kept me overnight on a drip. And even so, I had a hard time sleeping. So when they sent me home, I think that was a major no. They should have kept me overnight on a drip, because who the hell, I don't think dogs are treated like that after surgery. Could you imagine?
No. I mean,
Yeah.
no.
So one thing led to another. Just sticking with the pain issue. So I did get like an additional set of Percocet or whatever they gave me, but they never referred me to the pain management clinic.
Hmm.
And I fill out those forms, where does it hurt, how much, and blah, blah, blah. So they get that information from me, but they don't do anything with it. And I don't know why, if that, but it's like, Jesus, what kind of, you got to ask yourself, what's it take to get that? What's
I
going on
think
here?
honestly, especially with pain management and things like that, I think it's there's an interesting kind of excuse me, there's an interesting kind of like overcompensation for what for the mistakes that were made in the opiate crisis, right? Like to that led to the opiate crisis, right? So or at least the oxycodone, that part of it, because they overprescribed. Now it seems like there's kind of the pendulum is swung in the opposite direction, and then people who really need help can't get it, really need these things, can't get it because they're concerned about valid
Yeah,
concerns, but taking it too far. You know what I mean? It's there has to be a happy
yeah.
medium here.
And also the literature I looked up for my operation, that procedure. What do they say about it? And they downplay the pain level. They say pain should resolve with the inflammation going away. And it's like they don't even talk about, there's a huge load of nerves in that area. They don't even talk about that and
And the thing
possible
is, regardless,
damage.
it would be to ask you personally. I mean, because clearly, if it's not what how they express it, what if it's not what should be expected, if it's more painful than it should be should be expected, then they would want to know that because that would indicate that it is not the same. It's not going
Yeah.
as they would expect it to.
So the message they give us patients is what is it? Best practices or evidence-based
Hmm.
practices. So my position is you're not listening to us.
Right.
You're not getting that data that you need to add to your evidence,
Right.
or they're cherry picking, you know, and there's patients out there being left out when they give us that reason. So we don't know this because we're isolated and we're not hearing from others. So
Right.
we think, oh, I'm just an outlier, or they tell us you're one in a million. So it's that propaganda we're fighting. We feel like we don't deserve better care. And so that's one of the reasons why I want to fight for better quality patient care.
Right.
And I just don't see it. I see it in the literature that I follow. I'm in a American Society for Professionals in Patient Safety, and it turned into Institutes for Healthcare Improvement. So I follow that medical literature on quality care and patient safety. They know this,
Hmm.
but it's not widely discussed in the hospital.
And of
So
course, at the end of the day, I mean, why would they skimp on care? Why would they
I,
skimp on these things, and why would they, try to do the bare minimum because it's all profit driven. So it's when it comes down to it, there's a direct through line to the quality of care that you receive, and what the motive is. You know.
I loved hearing Dr. Pavlina Chernova
Hmm.
talk about mission-based economy. Um, I think that way towards it should be patient needs driven.
Yeah.
So that's our mission: fulfill patient needs. And it's going to be difficult to transform from doctor provider dictated to a partnership. And one of our issues is we have a difficult time communicating. So, like, I'll stutter, you'll notice, or trip over my words. That's that's like the tip of the iceberg. There are a lot of people out there who cannot communicate at all. And in order to get quality care, I say you have to communicate your needs to the provider,
Yeah.
or it just doesn't happen. They're not assuming you need this
Right.
until they hear you say it, so that you don't get that referral.
Which
And with brain injury, It's not going to happen
I was
all
gonna
the
say,
time.
like, this, bring it right back to what we were talking about with the paperwork and things like that. Why would you know what I mean? It seems like if it were actually, if it in a world that made sense, let's say that, like in a system that made sense and actually was patient, driven. I'm sorry, you said it so well, and I'm forgetting, patient something centered, but
I forgot
health
to.
centered, truly health centered, right? But in a world that made sense, they would make sure that, people, I mean, this is knowledge, this is common knowledge, right? That if you have a brain injury, these are the type of difficulties that you're going to have. And so these kind of things, you would figure out a way to be able to support people, especially knowing that that's going to be their challenge.
Yeah, what also helped out was I accidentally came across literature on how to rehabilitate someone with a stroke. And that's
Hmm.
also a brain injury, different type, but very similar symptoms.
Hmm.
So I read through it and I saw all of these different providers that they recommend giving to somebody who's coming back from a stroke. And I'm like, why didn't they give me this? I had these symptoms. So I took this literature back to my primary care physician and I asked them, why didn't I get these?
Hmm.
And you number one, you hit them. You hit them hard with that, it's true.
Hmm.
And they give you an excuse or they tell you, I didn't know. So maybe they weren't brushed up. So going to a grand rounds held by I don't know what you'd call them, occupational therapy, physical therapy, speech language therapists,
Hmm.
they gave a grand rounds and they said their mantra was, when in doubt, refer. And I'm like, that's what we got to tell these guys.
Hmm.
When in doubt. So when you don't understand what's going on with
Right.
this patient, refer to somebody. It's like pass them on to somebody who does know
Right.
so
Especially.
they can give them the services they need.
Yeah.
And that's not happening.
Hmm.
Um, you know,
Oh my god, and dealing with insurance I mean, I know, having to go to specialists, and unless you have this piece of paper that says that you have this referral and you get it just the right way and the right time and blah 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 and all that stuff, they're gonna deny the claim anyway, and you're gonna be. I mean, they're gonna
you,
deny the
need-
claim anyway,
you need
regardless.
the diagnosis.
Just always
So
right.
you have to have that diagnosis. So they have to screen you. They have to be sensitive enough to see you need that,
Hmm.
and then give you that assessment, evaluation, and then the diagnosis. So that's a process right there. And so many places where you can fall through, and I did many times. Um, yeah.
I think there's another thing that I wanted to talk about. This is something that you and I have kind of connected on, but I wanted to bring it up a little bit. I think essentially, let me just preface it this way, right? Because when I look at the way that we, um, uh, the way that we have this, things are treated as if it were a sane world, right? Like things are treated as if this is how it goes, and you get this treatment and da 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 and all that kind of stuff. And unless I think you hit the nail on the head when you were talking about connecting with people in these peer support groups, because then you realize that you're not the only person, and then you realize that kind of the way that it gets talked about, like you're one in a million, is not real. Like that's not. That's not true, right? But you have to connect with other people in order to understand that. And I think honestly, a lot of things, you could draw that line with a lot of things that, this expectation, the American dream, blah, blah, blah. I mean, there are so many other things that we could, identify this kind of cognitive dissonance, right? But that's really hard to handle. And especially when you're going through something, as traumatic as, the situation that you have had with a brain injury, right? And
Right. We're kind of told to heal on their schedule.
right. Oh, it's
So
so weird. How
they
weird is
plug you
that?
in for therapies before your time, before you're ready for it. So I should have been in bed sleeping. I slept through the whole first month after that head injury.
Yeah.
And I just woke up just to do the cooking and whatever had to be done. Then I went right back to bed. And by the way, they didn't do a call after the surgeries. They didn't do like a nurse coming in to check for my safety because with that severe an injury, I could have burnt down my house, leaving a burner on, and I could have fallen down my stairs. So on those walks to the bus, because they restricted me from driving, the sidewalk cracks, instead of looking parallel, they were X's. I'd see two driveways, more trees than there were, things like that. So that's what I was experiencing. But they saw an athlete who was able to balance okay. So I didn't really get that physical therapy for fall risk. So they didn't assess me properly or whatever. I passed with flying colors because I was Miss Athlete and I could account for that balance. But in reality, I was at risk for a second concussion, and that could have sent me into a coma or something. So yeah, I forgot where we were going with
Yeah, no,
that. You started something I wanted to add to,
yeah,
but
I
I veered
think
off.
just kind of this idea, this kind of, it's tough on your mental health is what I'm saying, is to kind of sort through this. You're already dealing with a traumatic experience. You're dealing with your health getting back to normal. I mean, you're dealing with all of these things, but at the same time, it's like you look
We're
for,
reinventing the
right?
wheel, I called it, because I'd watch everybody come into the peer support group going through the same thing by themselves, trying to navigate the system, trying to figure out what's wrong with them and how to talk to their doctor and ask for what they needed. And, I've never heard of a speech language pathologist
Hmm,
before having a brain injury. So I didn't know to ask for one. I
right.
didn't really know what they did. So it's terrible, but they put that on us. That's not good quality care in my book, you
No,
know?
no.
So, yeah. Fuck, I forgot where you were
No,
going again.
it's okay. I feel like it kind
Almost
of just
there,
it's like
but
it illustrates and really emphasizes, I want to say, like, just the almost the savagery of the way that we set things up, and asking human beings. It's like we forget these are human beings. We're human beings, you know what I mean? And this has a serious effect on how we
one
function
of
and how we feel in the world and how we go, and even healing. I mean, when you physical healing is impacted by your emotional healing, and so it's like we're prolonging illness. We're prolonging, with the way that our system functions. Hmm.
one of the things I want to push for, well, a couple, I'll list them off. Patients' Bill of Rights, because I feel we need better protection. We need to be understood that we're vulnerable,
Hmm.
and we need that protection. A patient advocate. Now, not the one that's in the hospital, because number one, they're busy. They are so busy. I sat in a table at a symposium with all the staff of the Office of Advocacy, and I talked to them, and they are overwhelmed.
Right.
And their priority is to do for the hospital.
Right. That's
That's
their
their
employer. That's where
loyalty.
their paycheck's coming from, right?
Exactly. They're
Yeah.
not going to tell us everything that's going on,
Mm-hmm.
you know. So we need somebody from the outside
Yeah.
to be doing this. So maybe like state employee or something. So I'm going to look into that, by the way, when I'm done with all of this. I'm going to look into becoming a patient advocate.
Oh,
Another thing we need, shoot, where is it? Um, just better information, being better informed, um, what care should look like. So, what does quality care look like? We don't
hmm.
know. So, we don't have anything to compare what we're getting to what it could look like. And just that information, maybe the family member could help us and say, oh, we should look for this next,
Mm-hmm.
or, just a heads up. Um, Psychology, I am trying to think how I got my hookup with seeking mental health. Okay. After the injury, I went through a huge roller coaster of emotions. I was angry, went through grief,
Yeah.
um, just this change in my identity. All of these things were coming in on me. The world felt like it was crashing in on me. I did my best and tried to laugh. I listened to a lot of music, tried to put myself in a healing place. But once I started trying to get back, I tried to get back to work too soon. I felt pressure that I had to
Of
do
course,
that.
because of course.
So too soon, and I crashed. I had a mental breakdown following graduation from an accelerated program trying to teach in a high
Mm.
school. The kids loved me because I was weird and different. we sang we sang the Oopa Loopa song, and we were learning glucose metabolism. I
I
thought,
think I
why
might come
not?
to your class.
Sugar,
That
it's
sounds
fun.
good.
But I crashed. I had a horrendous time. They really dumped the stress onto me, and they didn't give me accommodations. That's a story I got to backtrack. Um, during the interview, so I struggled to put together an essay to apply for the program. It took me months, what probably would have taken you like a week to put
Mm.
together. Just brain injury. I struggled. So I submitted that essay. They had me in for an interview. I sat there and I told them my story. I was bawling. I
Mm.
told them clearly about I had 2 surgeries already. I was in for the third a month before the program started. And so they heard all of that. And when I did complain, I was falling asleep at the computer, wasn't able to finish on time my assignments. They did give me an extension, but it was hard. That was a hard win. I
Yeah.
had already gone through the stress, and I was already feeling stress from my mentor who was really laying on to me. Um, then I had a crash, mental breakdown after graduation. I went to Home Depot, and my friend met me there and recommended that I go seek counseling.
Hmm.
She was a neuropsychologist. And without that, I wouldn't have started off in something like that.
Hmm.
And it's sad. That's how I got my care. And then a classmate from the program took me to my first peer support group meeting. And who facilitated that was my speech language pathologist.
Hmm.
So that's how I encountered speech language pathology, that therapy.
Hmm.
And it's just like, um, just one thing after another. So what they provided me, if you made a table and listed the number of therapists and doctors I saw that they gave me referrals to without me asking, short, and it was at least double. I made a list, at least double what I put together on my own. I call it
Hmm.
my do-it-yourself care.
Hmm.
So, that right there says a lot about quality patient care. And I felt that I wasn't getting it. Even the peer support group, I was told, you're not appropriate for that group, as if they would know. You know, because I lost my job, I lost the social network. So I didn't have my friends around me.
Hmm.
So I needed it for that. Again, I wanted somebody to confirm what I was experiencing, my symptoms. I wanted to hear that that was normal
Hmm.
and that it was okay and it was a sign of healing. I wanted to hear that from somebody who had been through it themselves.
Yeah.
I I gave them my contact info. Please get somebody hooked up with me. I need to hear this. You know. So
Yeah. I was just gonna say. I mean, it's funny because I'll like post on social media and stuff like that, and be very vocal about what I'm going through, and that kind of stuff. And people will back to me and be like, "You shouldn't post so much, blah blah blah," or you shouldn't say things like that, or these different things. And I'm like, you want to know what the thing is? You want to know why I continue to do that? Because I want to destigmatize vulnerability, and I want to allow space for other people to feel like they're not alone, because that's what happens. I get messages from people saying they don't want to post, they don't want to comment on it, whatever, because they don't want to put themselves out there, but they will thank me for saying something because that's what they're thinking, and at least they know they're not alone. I think a lot of
the
times, that's
affirmation.
Right, right. And that seems like, to me, what this kind of the peer support groups, that kind of thing, that's what that does is to make you realize that there are a lot of other people who are going through it. I mean, just like the human aspect, I think, the kind of the causing emotional stress and that kind of thing. I think people devalue that. And it's really sad because it does have to do with the way that we kind of make things or we look at things like they're it's like impersonal, this like sterilized, impersonal dealings, when it is your health and it is whatever. When I tell the story, I don't tell it so much anymore because fortunately I was able to get the bills paid through my work and through a fight. But I broke my arm, shattered my wrist. I shattered my wrist, and so those plates and screws, yes, I have those in my thing
Mhm.
and whatever. And I remember, so this is all in the space of 1 week. I shattered my wrist the night before Thanksgiving. Um, then I came home from being away for 5 days for Thanksgiving to find that a pipe had burst in my house that literally took out the first floor of my house, like down to the studs, like everything down to the studs. And then, as the insurance guy is at my house, my dad came up to help me. We didn't have heat, like it was just a total nightmare. My dad came up to help me with, the insurance inspector guy and whatever. And my dad gets the phone call that my brother died unexpectedly at 43 years old.
Oh,
And this all
no.
happened. I mean, I remember they put me under for the surgery. And I remember just thinking, like, I don't know if I have the will to wake up. Okay. Going through, because this is my brother, my best friend. I'm sorry, I don't mean to get emotional, but it is fucking emotional. That's the point, is that
And it
we're
snowballs.
human beings who are going through human situations, and we add these ridiculous things that who excuse my language, but who fucking cares about the bills or like about this, the whatever, these things that you are forced to deal with at that
Mhm.
time when you're already going through so much else. And it's interesting because that's the point, is not wanting to share or not necessarily feeling like this is a story that um because I was a year and a half later, I was able to finally get the insurance company to pay for that year and a half. They were leaving me with it was $7,500 of the bill. I mean, that wasn't the total. They paid some of it, like they paid half of it and then left me with that. So then I have to like fight for something when I'm grieving, when I'm dealing with the insurance company in my house and getting my house put back together while you're going through, because we're human beings. You know what I mean? And yet, because it was paid and the money part was taken care of, it seems like a less significant story. But really, I think that that's what it illustrates, is that we're human beings. And in the same, I hear a lot of that when you share your story, and I appreciate that. So I think that is. I'm sorry.
Yeah, and I want to build on that. We know that the stress is detrimental to you. As far as brain injury symptoms, it worsens and it delays your recovery. So both that and your immune system, they know there's an effect on that. So if you're more prone to get sick or whatnot, but yeah, definitely. And it's funny because I hear these stories when something significant happens, it's almost like you're more vulnerable to everything else dumping on you.
Yeah.
Because, yeah, I went through it was like one thing after another. And it's like you feel like you are crushed.
Yeah.
You feel like, it's so humbling. It just wipes you out emotionally. You're not, you know, yeah, I
Well,
hear you.
I just want to say thank you. I appreciate what you're doing. I appreciate, um, you know, I think a lot of us go through things, and I really appreciate and respect, especially the people who use that experience to turn around and try to help others. And thank you.
Well, I really appreciate Real Progressives and you for giving me a platform to. I mean, I see this, we need to empower people.
Yeah.
We need to inform, we need to empower, do whatever we can. And that means raising voices up,
Yeah.
raising voices of folks who have been disproportionately affected. Because if we just listen to the media and listen to our leadership, everything is awesome.
Yeah.
You know,
I love that. Our kid wait, so how old is your son now?
he is 21
Oh,
and he's
okay.
sleeping in. Thank God, because if he heard mom talking, he's like really critical of me.
That's
So
funny.
I'm like glad he's asleep. But
I have, 2 boys, and my youngest, his new favorite
oh,
thing is just cracking, like, mean jokes on mom all the time now, and I'm just like,
oh,
I don't it was funny at first. Like, can we not be mean to mom anymore? Like, anyway, it's
oh.
funny. Yes, the boys, the boys. All right.
I was lucky because I knew my cousin has a daughter who has Marfan syndrome,
Hmm.
and she has to. It's a collagen, so eyes, everything, heart, everything's affected. Her lungs. Um, she has to have so many surgeries growing up. I think her sisters. It puts them through stress. It's like a secondary trauma. Seeing your
Yeah.
sister hurting and going through all this mess. So I saw that and I realized my son could be going through something similar because he was there and he saw mom in her worst place. So it's almost like he probably could have used some mental health counseling to deal with that because he was going through both the divorce and mom's, knocked for a loop there.
Yeah.
So yeah, I was very conscientious of that, and I had to keep my pain and everything away from him, and try to put that happy smiley face on. Mom's all good.
Mm.
So I
See,
got
I
all these
remember the
photos of me smiling, but I know I was in
right,
extreme pain.
right.
You know.
See, I always say, my kids, when you said if it weren't for my son, I don't think I'd be alive. I feel that intensely because, I lost their father, who is my fiance at the time. He overdosed, and
Oh, that's
I
what
had
happened.
I
Yeah.
had our youngest. I only have 2 kids; they're both his. But anyway, and I had my youngest 2 weeks later. It might have been 2.5 weeks. 2 weeks after Corey passed, and so my kids they went through the whole process with me. I didn't have time to just like, sit back and grieve and,
No
set
morning.
myself aside
Mhm.
and do whatever. You're in survival, you're doing what you need to do, and whatever. And of course, I'm madly in love with my children. So that's that. But at the same time, you're going through this grief. And so I do think that my kids experienced secondary trauma in that way because it was just it was us against the world, that kind of thing. And so they went through it with me, you know what I mean? we
And
we
you can only hide so much. You
right.
think you're doing a good job, but it shows up.
They know, oh
And
my god.
I've learned to give space, like you were saying earlier, give space, give people a break, and don't judge. Because I was judged, and I tell you, it's like it's like a stab in the heart, and then they love to twist it,
Yeah.
you know.
Yep.
So I learned to recognize it
Mm.
and say, I'm above that. I do not deserve that.
Yep.
So
Know your worth.
once you're able to become aware and see that coming at you,
Hmm.
you're in a place to better advocate for yourself and then advocate for others.
Yeah.
And like I said, I'm just lucky I made it this far, but I'm.
You absolutely are lucky to be alive right now. Like, I mean, just listening to the story, I'm like the car flipping and the this and and I'm just like, and you're here. So you're a miracle as far as I'm concerned. And you should be treated like it.
A bunch
All
of
right.
hard
Well,
work.
we gotta wrap it up. But thank you so much. I really appreciate you doing this. I can't wait to meet you actually in DC.
Thank you again. And I really